Good morning, everyone. I'd like to call this informational meeting of the House Aging and Older Adult Services Committee to order. Everyone should know this meeting is being recorded, and members and guests should silence cell phones and electronic devices. For attendance purposes, I'd like to ask each committee member to introduce themselves by stating their name and the district they represent. Let's start with you, Jess.
Good morning, Representative Jessica Benham, the 36th District out in Allegheny County.
Good morning, Representative Eric Nelson, Westmoreland County.
Izzy Smith-Waddell, 49th Legislative District, Lancaster County.
Representative Joanne Stair, the 107th, Northumberland and Schuylkill County.
Representative Barb Gleim, the 199th in Cumberland County.
Good morning. I'm John Schlegel, representing the 101st District in the heart of Lebanon County.
Morning, Jim Prokopiak, Bucks County, 140th District.
Good morning, Representative Serrato, 151st District, Montgomery County.
115th Legislative District, Monroe County.
Steve Menser, 97th District, Lancaster County.
Thank you, everyone. So today I'm excited that we've invited Secretary of Aging Jason Kovulich and Nathan and staff to show us how to navigate the PA CareKit. I'm extremely excited about this. We're going to have an event in our district this week where the Secretary of Aging and staff are going to come, and we're going to hold 2 events in our libraries and show seniors and those who are taking care of them how wonderful this new website is, what an unbelievable resource it's going to be, because in many cases we talk about this over and over again. You are taking care of a neighbor, a relative, a friend, as a caregiver before you even realize it, right? You're into it 6, 7 months, a year, and then you realize, oh my goodness, I'm a caregiver, and things are coming at you so quickly, and you don't know where the resources are, and you don't know where to even begin. And that's where this website comes in, and Nathan is going to show us how to navigate it. And so, yes, pay attention. Thank you. Secretary Kovulich, or Chair Menser, did you want to say something? I'm so excited. I'm forgetting what to say.
No, thank you for putting this informational meeting together concerning the Care Kit. And we all know that it's very difficult for caregivers to take care of their loved ones, and this Care Kit is really going to be beneficial, so we're all anxious to hear more about it.
Good morning, Chairwoman Madden, Chairman Menser, members of the committee. Thank you for the opportunity to speak about the work being done at the Department of Aging. Today, we are proud to highlight a major achievement for Pennsylvania, the PA CareKit. The CareKit represents a successful completion of one of the tactics established through Aging Our Way Pennsylvania, our 10-year multi-sector plan. We appreciate the resources provided to the department by the General Assembly, and we also thank the Assembly for its guidance and instruction. Your efforts directed the department to focus on the estimated 1.5 million unpaid caregivers living in every community of Pennsylvania who are providing an estimated $22 billion in unpaid services to their loved ones. What we've been able to provide Pennsylvania with is a resource that is responsive, comprehensive, simple to use, adaptable, and most importantly, always available. Something for everyone, every household, and anyone who will be caregiving or unexpectedly filling that role. There are many faces of caregiving, all of which we addressed this morning, and caregiving takes on many forms. Who are we talking about today? We're talking about the people in this room, people we work with, live near, and socialize with. As Pennsylvania ages, we as an administration, a department, and representatives have an obligation to connect these individuals to resources that can help them. In doing so, we keep more people living in their homes, in their communities, and we provide respite and support to caregivers, and we have been responsive to what countless older adults told us that they needed as we developed Aging Our Way PA. Aging Our Way PA strategically addresses the issues of caregivers and helps us to continue to strategically evolve the platform over the next 10 years to meet the ever-changing needs of those we serve. We as a department can only accomplish this through the inputs of those we serve, our stakeholders, and our partners. Like all initiatives at the department, we took extensive efforts to solicit feedback from real-life caregivers, care receivers, and our stakeholder partners so we can produce the most responsive and best product we could. Thanks to the support of Code PA, our Care Kit is available everywhere to everyone. As we consider nearly 1 million older adults aging in our rural communities and the remaining 2.4 million older adults across the state, we look to our partners in the library system to help us make information safely and easily available. We look to our AAAs to continue to support this growing population of caregivers. And we look to all of you and your district offices or senior fairs to make sure the resources are shared, discussed, and distributed to those who need it. Your investment has not only served the caregivers I touched on, but the caregivers providing 82 million hours of care to loved ones with Alzheimer's. It has provided support for grandparents raising grandchildren, support for caregivers accessing senior centers, caregivers seeking safe and well-trained in-home support, and support for the paid caregivers who do this incredibly demanding job every day. The return on the investment is significant for every person who is facing or who will unexpectedly face the challenges of being a caregiver. Aging Our Way PA is our path to accomplish in meeting the needs of older adults together. It is Pennsylvania's plan, not just the Department of Aging's plan. We have succeeded in moving on and completing several of our tactics since the publication of Aging Our Way. This is tactic number 128. It was accomplished in only 9 short months thanks to the work of Nathan Lampenfeld and others, who is working to bring projects like this and PA Link Refresh to light for Pennsylvania. Thank you for your work supporting older adults. Thank you for the work that you support this department with. I just want to also highlight for for those that have been using the CareKit. In our first 7 days, we saw 37,000 people take a look at PA CareKit. They spent an average of 7 minutes on the CareKit, per visit, and we completed over 1,000 quizzes in 7 days. So we know we created a resource that is responsive. We know that we created a resource that Pennsylvania wants, and we appreciate your support in doing that. Nathan's going to help us take a deep dive now into the CareKit itself, and we can show you how actually comprehensive it is and how it will benefit everyone in Pennsylvania that needs to access it. Nathan?
Sure. Thank you. As Secretary mentioned, my name is Nathan Lampenfeld, Special Assistant. So if we could move to 2 slides. Thank you. Okay. One more, please. Thank you. So as the Secretary mentioned, the PA CareKit is part of Aging Our Way PA. That's our multi-sector plan that we developed with over 20,000 points of engagement with people all over the community. In every county, we held 210 listening sessions, one in every county, some in different languages, some for different audiences like the LGBTQ community, like the deaf and hard of hearing and blind and low vision community. So we really, very stakeholder-driven process. The plan has 5 priorities, 36 strategic approaches, and 163 actionable tactics. Tactic number 128 is what we're talking about today, the Caregiver Toolkit. Next slide, please. We're now calling it the PA CareKit. It's a collection of tools, information, and support. It supports caregivers through key challenges in their caregiving journey. It's personal, practical, and ready for all kinds of caregivers. And a big point is that it's available both digitally and in print. And I'll get into where the printed materials will be heading a little bit later on. Next slide. So as the Secretary mentioned, we completed this project really in 9 months through 4 tasks. Really high level, again, we built on additional stakeholder engagement. We held a survey, we held focus groups, making sure that the CareKit was designed around the needs of caregivers. We worked with our agency partners to develop a stronger vision, and we did pretty extensive research on what was out there already, different CareKits that are other toolkits that other states had, other organizations had, and we determined what we liked, what we didn't like, and what we didn't see but wanted to innovate with this CareKit. Then we moved on to the content development, again, refining those different subjects and topics that people need to know about, building tools like worksheets and resource guides, and then making sure it was as accessible as possible. So for people who speak different languages or reading different languages, and for reading level, so making sure it was accessible for all members of the community. Then we built the platform on pa.gov with code PA. We built in this Understanding Your Needs quiz, probably the most exciting aspect of the CareKit, and we'll get into that more as well. But also just making sure that the site is well organized, that it's intuitive, that's easy to navigate, and that the resources we're providing are as targeted as possible. And where we are now is launch and outreach, so rolling out the CareKit. We have a grassroots informal campaign. We're going to libraries and community centers and providing informational sessions. We also have this formal marketing and media campaign, so we're developing broadcast, we already developed, but we're waiting to launch broadcast, digital, all sorts of different ways where the CareKit will target caregivers and they can find what they need. Next slide, please. All right, so a bit about the development survey. So we had all this stakeholder data and information from the 20,000 points from Aging Our Way PA. We just wanted to continue to refine that data, to validate it, make sure it was accurate. So we launched another survey. We had about 250 responses, about 90% of which were those family-friend caregivers, which is sort of how the tactic is designed. It's under the strategy to support caregivers and care partners, which is that informal caregiving population. All the themes that we heard, all the themes that we gathered, were things we've already heard. We know that caregiving has a steep learning curve, that caregivers are often unaware of what programs they may be entitled to, what benefits they can activate. We know that we need to meet caregivers earlier so that they're before a crisis situation, before a hospitalization, before a more significant level of care that they need to provide. We know that caregivers face a lot of stress. Caregiving is, I'm sure there are caregivers in this room, it's highly emotional experience. It requires a lot of compassion, a lot of communication. We know that caregiving is too difficult for one person, that it requires a support system to be able to do and to do well, and to be able to manage that stress. We know that caregivers face unrealistic expectations and progressive challenges, so people don't really know what they're getting into. They feel overwhelmed, they feel emotionally isolated. But we also heard from seasoned caregivers that once they found resources and they found information that they needed, that the journey became much more manageable. We know that there are significant financial challenges, especially for those middle-income families, so people that don't quite qualify for certain entitlement programs, but that are, don't necessarily have the means to reasonably pay for care out of pocket, knowing how expensive it can be. We know that caregivers need proactive education to navigate the evolving needs and the progressive challenges, so, not really knowing what they get into and how their role might change over time. And we know that there are navigation challenges, which is why we paired this project with the refresh of the PA link. We know that people want to be able to call a number and speak to a real person to get connected to resources in their community. They don't want to have to navigate a million different websites. They want it in one place. And they want to be able to get printed materials, physical copies of resource guides that can help them with their journey. Next slide, please. And so we synthesized all of that data into these key design elements. So we have visible and convenient. We know that caregivers are pressed for time. We want to have all the information on one place. We want it to be searchable. We want people to be able to find it when it's 11 p.m. and they're panicked about the care that they have to provide the next day. Realistic and encouraging. So we tried to strike a tone for the CareKit that's less about here's what your experience should be. It's it's going to be all these challenges, or it's going to be this wonderful, loving experience. Often people don't really resonate with those two extremes. So we wanted to focus on the realism of what you're likely to face, that there are tools out there, that there's information and programs to help you, and really encouraging and empowering the caregiver to feel confident in the decisions they're making and the care that they're providing. Clear and practical. So we know that caregivers often struggle with the complicated jargon, the different acronyms and names of programs that only really we understand in state government, as well as unclear instructions. So we tried to make this information as easily digestible as possible, directly translatable to their care practice. We have up-to-date and accurate, so we know that programs, policies, and links change every day. So we have to continue to evolve and adapt the CareKit to make sure it's a living product. It's not just something we print and publish and hand out. It's something we're growing as things change. Comprehensive and inclusive, it has to meet the needs of all kinds of caregivers, knowing that there's different stages and challenges, and proactive and targeted. So we have to meet caregivers where they are. We have to give them the information before they even call themselves caregivers, when they're still spouses and siblings and parents and all of that. Next slide, please. And then just before I go into the demo, I always forget my thank you. So here are all the people that helped in developing the CareKit and refining the different information there, especially Angie Bixler, who's the digital director at the Department of Aging, designed all of the website and the very nice materials, and Meredith Hughes, who's with the University of Pittsburgh and a National Academies of Medicine fellow, who helped with, again, the content the development there. And then I'm going to shift over here and do a demonstration of the CareKit. That would be great, yeah. And then if we could make the screens, okay, yeah. Should be, I think I might have to do duplicate screen. that should be good. Full screen, maybe not. So this is what the PA CareKit homepage looks like. So there's a few advantages to having it on the PA.gov website. We're more search engine optimized, so people are more readily able to find the CareKit. It helps with our language access. So if I'm using a smartphone where the settings are set to Spanish, all of this text will automatically be translated. But if I don't have access to a device and I'm going to a library to seek this information, I can click translate and go down to Spanish, and everything switches over. And the text is translated there. Then we have our tagline, personal, practical, and ready when you are. And we have some introductory language, again, infused with that empowering, encouraging language throughout. There's 2 buttons here: take the Understanding Your Needs quiz and apply for the Caregiver Support Program. So we'll get to the Understanding Your Needs quiz again. I'll get to that a little bit. And then there's the Caregiver Support Program. So the CareKit is designed to be its standalone product. It's all this great information, these worksheets and guides, but it's also designed to be a funnel to our existing aging programs, our existing community resources, like the Caregiver Support Program. And then moving down, so we have Stepping Up to Care, another key motif. Our navigation pane on the side where I can go to other pages on the Department of Aging or navigate the CareKit sub-pages as well. So all of the information is housed in these 3 sections. First steps, that's where do I get started? I'm a brand new caregiver, maybe I'm a seasoned caregiver, but there's a new level of care that I'm having to provide. Caregiving resources, how do I take better care of the person I'm caring for? And self-care resources, how do I take better care of myself? On the homepage, we also have the key caregiving terms and concepts. It's essentially a glossary, everything, all the terms I'd need to know. If I need to know what a nursing home is, I can click N. There's nursing home, other terminology, other acronyms, and a clear definition. And we also have become a professional caregiver, so we recognize that there's all these unpaid caregivers, as well as all this direct care worker shortage and crisis, and these people with learned caregiving skills that could have a career in caregiving. This just provides some information on how to do that in Pennsylvania and where you can learn more. And then just going through first steps. So there's that button again. But we introduced the first 5-step framework. This is basically a framework we developed so that caregivers can holistically and critically assess their entire caregiving situation. It goes through these steps that, and then it's embedded in a number of different resource guides with questions that help you think critically about the care that you're providing and what your situation looks like. So I'll go through that framework in our general caregiving guide. It's called First 5 Steps, a Get Started Guide to Caregiving. Again, Angie Bixler designed these really nice guides for us. So the introduction is called Stepping Up to Care. I call it the what to expect when you're expecting of caregiving. So parents might have 9 months, give or take a few, to prepare for their role, but caregivers might have months, weeks, days, or a phone call before they need to step up and provide their care. So this just serves as, knowing that every caregiving situation is different, it tries to outline some of the milestones that you might expect. Again, really focusing on that tone of empowerment and encouragement. So then we go through the steps. So step 1, understanding your role. Before you begin, take time to reflect on your role as a caregiver. There's a page for notes, so that's the whole point. We want people to jot down their thoughts. That provokes more additional thinking. But it asks questions. This section is all about the care that, where you fit in the care situation. So what kind of support you're providing, what type of support the person you're caring for needs, how your responsibilities might evolve, how you're feeling about the role, what motivated you to take on the responsibility, how has caregiving changed your relationship or with yourself, the relationship with yourself, what areas of caregiving feel most overwhelming, what feels most rewarding, and how has caregiving affected your personal goals. We know that caregiving is, people describe it as a selfless act, but that selflessness can also be dangerous to the caregiver and to the care recipient. So trying to get people to think about, beyond that sort of labor of love of caregiving into the more practical matters. So then step 2, gather information. This is about collecting what you need so that you can make informed decisions. So what does the person you're caring for value most at this stage in their life? How can you best support their physical and emotional well-being? Are you communicating openly with the person you're caring for? What information do you need to improve care? So what questions do you still have? What types of health conditions are the person you're caring for living with? What medication do they take? What benefits or financial aid could be available? And what tools and technology could assist you in caregiving? Then we have step 3, strengthen the support system. So we know that caregiving is not a solo journey, how you look at the entire support system. So who can offer help, what kind of help can they offer, and when can they provide help? Who can offer you emotional support, knowing that there's those practical matters of transportation and meals and those types of things, but also you need emotional support. What information do you need from health providers? So preparing that list of questions ahead of a doctor's appointment or occupational or physical therapy. Are you communicating openly with your support system? What community or professional resources are available to you? Again, helping with those care tasks. And what organizations can offer help? Here's where we highlight the PA link. Again, there's that 1-800 number. You can call, talk to a real person. They get you connected to those community resources. Then we have step 4, make a plan. So getting people to think more prospectively about the care tasks, knowing that planning reduces stress and ensures that no detail is overlooked, especially in an emergency. We know that emergencies are really where that care level can progress, those falls, those low blood sugar spikes, things like that. So what does a typical day look like for you and the person you're caring for? How can you make those activities more efficient? What are their long-term care needs? So that's housing, mobility, financial planning. When are their next medical appointments? Being prepared for a medical appointment rather than the day of. How do you prevent accidents in the living space? How will the person you're how will the person you're caring for be supported in an emergency or if you are unavailable? And what are their wishes for care in the future? So documenting those preferences for long-term medical care and end-of-life decisions. And step 5, take care of yourself. So again, we like to recenter the caregiver. Caregiving is hard work. Your health and well-being matters. You can't fill someone else's cup if yours is empty. So how do you manage stress? Are you taking care of yourself, eating healthy, exercising? Are you sleeping well, taking time for your hobbies and things you enjoy? And then what support do you need to feel balanced? So that's a term we saw in the caregiver surveys and the focus groups where people didn't necessarily articulate what they were lacking, but they said they were out of balance or they wanted to seek balance. Do you know where to seek additional help? So trying to encourage people to go to caregiver support programs, counseling services, respite providers. And then are you celebrating success? So often as caregivers, we focus on what we're not doing right. When we learn new information, we think we should have done something differently all along, but we rarely recognize and reward ourselves for the hard work, balancing caregiving with our personal responsibilities, and also improving the quality of life of the person we're caring for. Then all of the resource guides have these 5 resources for caregivers. That's our local area agencies on aging, the AAAs, the adult day centers, senior community centers, the PA Link, and the caregiver support program. And then it also highlights the helpful printables, which I'll get to a little bit, but they're 15 worksheets. They're designed to help with specific caregiving tasks, those logistical and practical things that people often overlook. So moving down, so we have our general resource guide. Then we also recognize that there's a lot of common caregiving situations. So we created this many faces of caregiving section. Basically, we highlight these 9 caregiving scenarios. The spousal caregiver, someone caring for a spouse or partner, long distance caregiver, someone providing care from afar, parent caregiver, that's an older adult providing care for an adult or a grown child with a disability, the working caregiver, someone balancing their career with their caregiving responsibilities, solo caregiver, someone without that traditional family support system, sandwich caregivers, that's intergenerational, someone caring for their children as well as their parents. Dementia caregiver, we focus on this condition because it's so common among older adults and also comes with additional challenges and nuances and different programs as well. And youth caregivers, so someone in their 20s, teens, or younger that's either supporting the primary caregiver, their parents, or they're directly caring for an older adult. And we have the grand family caregiver, so that's someone, an older adult providing care for a grandchild. Oftentimes that biological parent is not in the care situation. So I'll click on the long distance caregiver. Again, each has their definition. There's a vignette or sort of an example, but I'll show you the guide here. So we replace that stepping up to care introduction with this vignette of glory and honest story. Each situation has their own. It highlights common challenges for both the care recipient and the caregiver in this type of situation. And then about halfway through, it shifts where it highlights things that the PA CareKit can offer for those specific challenges and where to go on the CareKit for resources, highlights specific worksheets and checklists. And then it moves down, very similar to our general guide. It just adjusts some of the questions. Again, we're trying to speak more directly to the caregiver. So for example, in this one we have, how can you make the most of in-person visits, knowing that when you're living afar, you have to plan visits more strategically for those more intense care tasks like home repairs, medical appointments, or updating care plans. Again, similarly, another adjusted question we have is, what can you realistically manage from a distance? Knowing that there's certain tasks you can, other tasks you can ask a neighbor to help out with, or you can hire a professional. And again, still highlights the same resources and printables. All right, and then we have our most personalized and most exciting aspect of the Care Kit, which is the Understanding Your Needs quiz. All right, so this, if people are familiar with the BuzzFeed quiz, it's very similar. I'm answering questions, 18 questions that are specifically about the care that I'm providing. They follow the same 5 steps, and then the output is this very custom, tailored resource guide with links that direct you to the places on the PA CareKit. So how often do you provide care? Weekdays. Who are you providing care for? How long have you been providing care? What types of health and wellness care do you provide? What specific health conditions are you helping to manage? Do you regularly receive support from others? Do you feel comfortable asking others for help? And then how has caregiving affected your relationship with others? And that includes yourself as well. Then making a plan. So do you have concerns about long-term care? What about housing? Transportation and mobility? Social opportunities and social participation? Financial and legal concerns? What about those crisis situations? So hospitalization, public emergencies like blackouts, or when I'm so exhausted I can no longer be a caregiver. And then do you know where to go for additional help? Then on to taking care of yourself. Do you feel overwhelmed as a caregiver? How is your physical well-being? And how's your emotional and mental well-being? And so as I click these answers, it'll take us to a review page where I can adjust anything, make sure I'm putting the right inputs in. And then if, I don't know who's logged in, if I could get their email and send the CareKit, or the, would you mind signing your email and then we can send you a, sure. Jason. Steven. All right, and your email? Easy, thank goodness. There we go. Usually mine is plugged in. But so as I click answers on there, what I'll get is a custom guide that corresponds to my needs. It also calculates burnout score based on the intensity of those answers in my care situation. So it goes around, and then we wait till we get our submit button. So we've received your request, and then shortly after, you'll get an email. And I won't look through your emails, I swear. Yeah, I'll stop.
While we're doing that, I just would like to mention people have many committee hearings this morning, so they're coming and going. And we've been joined online by Representatives Marla Brown, Representative Jones, Labs, Razel Rivera, and also in person, Representative Borowski and Powell. Thank you.
Waiting for that to go through. For some reason, maybe I did the email wrong. Okay. Uh-oh. Okay. Okay. Well, we'll just go for now until it comes through. So what it does is basically have, it has a timestamp so you can take different quizzes over time, and then it has bullets that correspond to how I answered. So I selected I was caring for a parent caregiver. The bullet will read, caring for a parent can be difficult. Can feel like a reversal of roles all the time, but there's ways, there's tools and ways that you can improve the care for your parent, and here's how to do it, follow these steps. And then there's other bullets that highlight links to the care kit. So it'll take you to worksheets, onto specific pages, things like that. So one of the first things we like to highlight is the caregiver video library. So those are, excuse me, videos we've collected from our partners, the AARP, UCLA Health, PA Home Care Association, and the Family Caregiver Alliance. And they're 5 to 10 minute videos, things like help with pain management, lifting and transferring, dental care, bathing and dressing, or things more advanced care like wound dressing and things like that. They're embedded right there. They're easy to watch. You can come back and watch them later if you want. Other pages, it will take you to our other caregiving resources. Sure. Okay. So this is where we have 12 different topics for how improving the care for the person you're caring for. So things like financial planning and paying for care, addressing those questions related to money management, long-term care needs, chronic condition management, so the most common chronic illnesses for older adults, aging and community, products and technology, so the different devices, modifications, and adaptations that help with aging in the home. Mature driver safety tips, so helping if someone wants to continue driving, can continue driving, making sure they're doing so safely, or when it's time to give up the keys or have that conversation, this will help you do that. Communication tips, one of my favorite aspects of the CareKit, helps with communicating with different audiences. So communicating with the person you're caring for, with healthcare providers, avoiding family conflicts, so that fight over Thanksgiving about who's not pulling their weight and caring for mom. Communicating with friends, so making sure people understand your situation. How to ask for help, how to frame those questions rather than making them accusatory, or making sure they're framed the right way, so we can keep our friends, family, neighbors, and healthcare providers conversations respectful. And then communicating with the person you're caring for when they live with dementia, knowing that comes with different nuances, or when the person you're caring for is deaf or hard of hearing. So not yelling and raising your voice, but making sure you're speaking to someone, maybe writing things down when you need to. Those different things you might not think of because you're having to communicate differently. Caregiving in a crisis, again, those different crisis situations and how to prepare for them. Caring for veterans, knowing that there's different benefits and entitlements available. End-of-life care, so starting conversations, providing care and advanced care for end-of-life, having resources for before, during, and after end-of-life. Legal support, long-term services and support, so the different settings and stages of care. Medication management, this is what we call a keystone care task. Most people become caregivers or identify themselves as caregivers when they start handling the medications, when they go to the pharmacy to pick things up or having to put things in the pill boxes. And then here's our printables. So again, 15 worksheets, to help with things like budgeting, assessing what types of needs someone has, coordinating caregiving, whether that's between friends, family, neighbors, or hired help. Caregiver decisions, so walking through, identifying a challenge, working through solutions as a care team, not necessarily the caregiver making the decisions or the care recipient making decisions that aren't really helpful for their caregiving and support system. Emergency preparedness, so getting that go bag ready for the different types of emergencies. End-of-life planning, so reflecting on the emotional, spiritual, medical, and practical decisions before someone dies. Funeral planning, again, making arrangements and for the different types of considerations before a person has died, making sure that obituary has everything I want in it. Home health hiring, so this helps with facilitating, having someone come into your home, taking care of your loved one in a very vulnerable situation with, shower, bathing, and dressing and things like that. But maybe I don't know what questions to ask. This helps. It helps me feel more confident that the person coming into the home is someone I can trust. Home safety, so it goes through the house, making sure you identify hazards, how to make repairs and changes. Older adult housing evaluation, basically, so what is the best housing situation for their needs. Important documents worksheet, excuse me. So keeping track of the different important documents, the sensitive information, things like passwords and birth certificates. In-person visit worksheet, so this helps someone who's not there all the time keep track of the changes in health, well-being, the state of the home, things like that I can track over time, make sure I'm addressing those needs. Long-term care worksheet, so this helps compare facilities. So maybe I'm looking at different assisted living facilities. I can ask the right questions, compare them, and it's all in one worksheet. Managing medications and supplements, again, those really practical logistical things that we don't think of that help us think less frantically about what we're doing and more strategically. And then medical appointments, so keeping a schedule, keeping track of questions before, during, and after, and writing those notes as we go. And then we also have all the printed guides here. Okay, wait, it came through. So here's what the PDF looks like. I don't know why it made me sweat, but so this is what the PDF looks like. Again, there's your Get Started Guide to Caregiving, a timestamp, the introduction, our bullets, our links there. So I'm gonna go to a page on the worksheet. So our caregiver coordination worksheet that helps with building our team, making sure everyone's doing what they need to when. So here's what the worksheet looks like. You write down all your contact info, who the relationship is. So if someone new comes in, or I get a vacation as a caregiver, someone can step in. But you write down the day of the week, the time, and the caregiver, and then what they're doing. Housework, meal preparation, shopping, place for additional notes. Again, oftentimes we'll see people move from beyond this worksheet into their own system that works for them. But this helps. It's sort of a stepping stone to get people to think about what they need. Okay, back to the Now we're going to go to the self-care page. So this has 5 pages: physical and mental self-care, emotional self-care, respite care, caregiver support groups, and working caregivers. And I'm just going to demonstrate what, so physical and mental self-care, making sure you're not reaching that point of exhaustion where you can no longer be a caregiver. So here are the steps to avoid burnout. And this is what a typical page looks like. There's an introduction, then there's bullets with a very simple, short summary statement, and then some additional instruction. We try to keep this manageable, so I'm not having to read a wall of text, but it's enough where I'm learning, and I can implement it into my care practice, but not so much where I'm overwhelmed, and I want to avoid it. But we do have a place where we have additional resources, links where you can dive deeper and gather some more information there. Any pages anyone wants me to highlight before we move on to questions? Anything? I'm going to highlight. I'm going to go to the communications page because it's my favorite. Oh, I did that one already. Sorry. So we'll go to the caregiving in a crisis as well. So this is another typical page. So we highlight the 3 different types of crises. So preparing for hospitalization, again, that short bullet statement, some instructions, and oftentimes we have sub-bullets where it's really specific information. And these are, pretty straightforward things, but maybe not things that people think of in the specific situation. So having that bag ahead of time, being courteous and patient to the people that are trying their best to provide care, knowing that your rights as a caregiver in a hospital situation, making sure you're minding the medications, having the list, bringing some extras, what to expect when you're in a hospital, that things like delirium, where the person you're caring for can act a little funny or a little out of norm, and making sure you're prepared for that. Asking respectful questions. Oftentimes we have to wait in hospitals because of the intensity of care or things like that. So making sure you're asking questions in a respectful way rather than, when is anyone going to see me? That's not really going to get to where we need to. And then trying not to rush discharge, knowing that's very important for you to get the right information you need to transition out of the hospital. And then again, places to learn more information. All right, so I'm just going to go through the custom guide PDF to the bottom so I can highlight all that, and then we can ask questions. Right. And then again, this custom guide still highlights our 5 resources as well. And that is the presentation.
Thank you, Nathan. So what's wonderful about it is that you can print everything out, right? Because older people, myself included, we like to look at things. We like hard copies. I put everything in a binder. It's awesome. And then it can be shared, right, if there's more than one caregiver. But if someone is computer savvy, is there a resource where if dad's taking care of mom and then, the sister comes over, is this online that people can log in and look at all the different worksheets, or is it just printable?
It's not you can't log in, but you can download any of the worksheets. We're making them editable so that you can type, if you want to type in your information. More people like to print them and write them. But also to your point about having printed materials. So I failed to mention that a major part of this, the majority of this was getting printed materials because that's what people told us they wanted. So we printed over millions of copies of the different resource guides, of worksheets, of business cards with a QR code, of folders, because not everyone has a binder, and then we're shipping them to a number of community locations. So to every of the 650 some libraries in Pennsylvania, of the 450 senior community centers, the 52 area agencies on aging, the 250 some adult day centers are, and then we'll also have boxes available for our General Assembly members. But millions of materials, hundreds, maybe thousands of boxes of these materials that people can share with other community organizations like churches, synagogues, other community centers, where people can, they act as sort of branding, but also they're really useful.
That's wonderful. Thank you. Chair Menser, do you have any questions?
Yeah, I do. Thank you, Chair Madden. Nathan, there's worksheets for caregivers so that when they are preparing to decide where their loved one is going, whether it be home health care or long-term care facility, they can prepare questions. But I noticed there's one thing that is kind of missing here, and it's the LIFE program. See, the LIFE program is such a unique model. I'm wondering, Secretary Kovulich, if there would be any consideration for a worksheet specifically for the LIFE model.
Well, I could say the adult day worksheet is easily adaptable because they're similar models to life. But the concentration on Pennsylvania Link has been embedded into this because of the LIFE program being part of the Medicaid services, so the dually eligible services that fall under the Office of Long-Term Living. So you'll see at key spots throughout, the care kit, you can go to the link, you can go to the PA link, and that will bring you to the services that can help you get enrolled in LIFE. Because we don't manage LIFE at the Department of Aging, we are very strategic in making sure people can get it and access it, but we couldn't necessarily brand it. But I think we could probably go back and take a look at how we can take that adult day worksheet and make that more adaptable to LIFE.
And just to add, so the long-term care facility worksheet is more focused on residential facilities rather than, LIFE program enables people to remain in the community. So that's why it's more comparable to those more intense facilities, and knowing that that's a bigger decision for caregivers that they often face, where they have to make the determination of where to go. I will say that we've highlighted the LIFE program in a number of places, knowing that it is such a valuable program. So in our long-term services and support section, under the community-based services, we have it there, as well as in our respite services section on the self-care page, knowing that it's pretty underutilized for that type of use. People don't consider it necessarily as a respite option when it is.
Thank you. One more follow-up. Now, the links that people can click on to get more information, if they're going to click on, say, a LIFE link, hey, is there a LIFE link, or a CHC link, or a long-term care link, would it be possible for then agencies to follow up on those requests? In other words, they made the request for LIFE. Now the LIFE agency in their region, can they physically follow up with the?
So something we're interested in building out with the PA Link is that there's this request services form, very similar to a lot of other social health referral platforms, basically, where I can click a form, click what I want, and then someone will do the outreach. And that's what we're really looking for with the PA Link to move. That's in with the refresh, that it's more of an outgoing situation.
So we're confusing links, I think. Okay. So PA Link is the Aging and Disability Resource Center, okay? The links that I think the chairman was mentioning, if you click on a link embedded in the care kit, will it take you to a LIFE provider specifically? So go into, yeah.
Yeah, so this would be the link. It takes you, so I'm clicking on LIFE here. It would take me to the Department of Human Services page on LIFE, where I can learn more information about the program, and then to call the independent enrollment broker for a more local community program.
So to your point, Representative, you could go into this, you can click here, you'll go to the enrollment broker, and then you as the person can express to the enrollment broker, I'd like to connect my loved one to a LIFE program, and then in your service area, they'll reach out to the LIFE programs in the service area. And your service coordinator will have that information as well.
Okay, I'm just, help me understand. I understand that, LIFE providers or CHC providers cannot solicit information without first getting some kind of a request. What I'm asking is, would this clicking on this LIFE link be a request for more information, which would then allow the LIFE provider to call the
The click itself doesn't work that quickly, but all these steps help do exactly what you're asking it to do. It gives the information to the enrollment broker that this family's interested in LIFE, which is that first key moment that, yeah.
But it would not, we would not supply the name of the interested party to the LIFE provider in that area. It would be provided to the independent broker,
Right.
correct or
Yes.
incorrect? Would there be any reason why it couldn't be provided to the provider?
I would really have to defer to the Office of Long-Term Living because
Yeah,
I'm
okay.
not familiar with all of their rules associated with that, and I know they're very strict rules in that space.
Thank you very much.
Representative Schlegel?
Thank you, Madam Chair. And I know that the PA CareKit has been relatively rolled out a short time ago, but I was wondering, has there been any feedback from caregivers who have utilized these resources? Can you talk a little bit about some of that feedback?
In a short period of time, we've had a tremendous amount. In fact, last week when I was at Dementia Friendly Lehigh at their event, they were the individuals who had been using the care kit were excited. They're happy with the materials. They felt it was a tool that they now had to be able to use to connect people and services. So we're getting positive responses. When I was in Luzerne County the previous week, again, positive responses. One woman whose husband has Alzheimer's, who is in his late 50s, even noted how useful this could be and would have been for her, when he first became diagnosed. So we are getting positive responses that this is helping people get connected, and the numbers that we have of individuals looking at our page indicates people are definitely accessing the resource.
Thank you very much. That is encouraging, and it occurred to me, looking forward here in Lebanon County, we're going to be sponsoring a Aging Your Way Festival next Thursday on October 9th, which is sponsored by the Lebanon Community Health Council. So I'm certainly looking forward to joining my staff and be able to connect with our aging population at that festival and that. So thank you very much.
You're welcome. If you need any materials from us or your staff needs to touch base with us, we'll be happy to help you make sure you have everything you need on CareKit.
Thank you very much. We absolutely will.
Representative Khan is virtual and has a question. Oh, I'm sorry, he doesn't have a question. He's joined us. Representative Nelson has a question, though, and he's here.
Thank you, Madam Chair. Secretary, you had mentioned Maximus, and that process, not specifically by name. I know there's been a lot of frustration and angst through there. The portal seems to really be helpful for tools and helping people prepare for what can be a confusing or intimidating process. Is there, within those initial links, information of, hey, these are your financials, or in order to, to kind of get set up, these are the things that you would need. This is how far back, you would need to go, specifically because we've had out-of-state caregivers that are trying to work with their parents in a situation, and it's, they may be in Virginia and not even sure what they need to gather before they come to Pennsylvania to, to start that process. So
Thank you for highlighting that really important point. And yes, it does help work through all that. And thinking about how we designed this, or Nathan designed this, or I shouldn't even say we. How this has been designed is, one, it populates readily, if you're in Virginia for a PA resource, it takes you here. That's why it lives on our website. So when you do that, the tools that you described, the looking for the 5-year look back, all of that information is contained here, so that an individual can be totally ready if they're going to go about that process and look to see, if their loved one is duly eligible.
And I'm not, I know I always get those cookie pop-ups, but does it enable a person to establish an account or have that memory, so they're going back in and they begin to use that portal? Will they be able to return at that same point? How does it, or when they leave, do they lose everything?
So the CareKit is on the PA.gov website, which we don't have any sort of portal at this point. Again, so Medicaid's not that simple, but we highlight all the different aspects there, including Compass, which is the portal for Medicaid. And my understanding, I haven't used it personally, but my understanding is that all that information saves. But again,
Okay, so the link would take them to Compass, and then
Right.
I think that's
And then
outstanding.
that creates their portal for.
Great, thank you, Madam Chair.
Okay, see no other questions. We'd like to thank you for taking the time to being here today and explaining this amazing website that will just be so helpful to anyone taking care of a senior. And yeah, we look forward to all of the work that you're doing and just seeing how it rolls out and helps everyone taking care of a senior. So thank you. This meeting is adjourned.